Ladies and gentlemen, dear colleagues, before giving my opening speech, I would like to continue on what Hakim said about the team doctor. Because I have chaired a lot of medical commissions and committees of all kinds in the world, but I remain with the conviction that the most important job that I have done in my life was to be the team doctor of my local team in Belgium. Because the team doctor does not do surgery on a lesion, but accompanies an athlete in his fight to reach the top. His whole personality has to be evaluated. And that makes the job of team doctor, and I hope that there are many team doctors here from clubs and from national associations here in the room. That makes that job so important, perhaps the most important one in the whole history of medicine. So thank you, Hakim, to have opened the Congress with a salute to the team doctor. I fully agree with you. And now I become the president, the honorary president of the Congress. Ladies and gentlemen, in my 42-year-long career, yes, it's a long one, at the service of sports medicine, I have been confronted, like many of you, with all kinds of injuries and lesions. And some of the most difficult situations occurred when a patient presented himself with growing pain. And as well in the research of a correct diagnosis as in the application of a successful therapy, the growing pain situation confronts the examining physician with important challenges. And for this reason, I really would like to congratulate the organizers of this important Congress, of this important World Congress, with the choice of this complex theme, and tell them that I was grateful to be nominated Honorary President of this Congress that brings together so many of the world authorities in this field. I don't know how you have managed to make such a fantastic program. My sincere congratulations. As you all know, growing pain refers to discomfort in the area where the abdomen ends and where the legs begin. But why is growing pain such a difficult clinical entity to diagnose and to treat? I see two essential reasons. The first one is the great amount of possible differential diagnosis, whereby we have to consider diverse osseous, muscular, tendinous, articular, ligamentar, vascular, and neurogenic elements. The second reason is the complexity of the anatomy of the groin and hip region, whereby many structures can interact. Indeed, we often see that there exists a referred pain, or in many cases, a pain pattern that cannot be attributed to one single structure. Among the most frequent tendinomuscular considerations around growing pain, we must never forget that a hip joint pathology is one of the classical causes that can produce growing pain. So, at the start of this important Congress, I remain with 4 questions. First question, do we have an adequate knowledge of all the anatomical structures in this region and the respective relationship between them? Second question, do we consider the multiple differential diagnosis possibilities essentially directed to a precise therapy? My third question, do we know the great scale of conservative, surgical, and rehabilitation therapeutical methods? And final question, can we establish intelligent criteria before we allow an athlete after recovery to train and compete again? Well, if at the end of this 3-day Congress we can present a correct answer to these 4 questions, then I think that this Congress will really have fully fulfilled its objective and give precise and useful indications not only to this auditorium, but to the whole medical world around sport and sports medicine. And this is, however, a very exciting challenge. that all my colleagues of the medical commissions, as well of FIFA, as of UEFA, represented here by my excellent friend, first Vice President of the Medical Commission of UEFA, and also my colleagues of the Medical Committee of FIFA. I saw Dr. Gerzini here, Dr. Zerguini from Algeria. Hello, Yassin. And I would like that we all share together with you the knowledge that we will have learned here in these 3 days. Thank you very much for your attention.